Hello, everyone. My name is Debra Hopkins. I'm the president and founder of Breaking the Chains Foundation and also a health coach. And for those who have been following BTCF, we have been sharing conversations and content during this month for Mental Health Awareness Month. And so today, this conversation is all about speaking up on teen mental health. And I would love to welcome our board member, Breanna Lynn, who is a mental health clinician by day and a children's book author by night. I don't know how she does it. She holds a bachelor's degree in psychology and a minor in family studies from the University of Nevada and a master's degree in forensic psychology from the Chicago School of Professional Psychology. So, hi, Breanna. Thank you so much for having this important conversation.
Hello.
Yes, and I'm going to quote you on this, on the importance of speaking up from any and all parties involved to help address the mental health epidemic we are in. Would you say that is, you said it.
Yes, you got that hook, line, and sinker. You got everything. I solely and truly believe that. You are 100% right. That speaking up piece, and we're going to do a lot of talking about speaking up today, is, I would say, a core principle to how we address mental health concerns with teens.
Absolutely. And we know that mental health conditions, they begin at such an early age. And, these youth are just learning to not even talk about their thoughts and emotions or how to identify their thoughts and emotions. So the more obvious symptoms we seem to see are behavioral, but can you please share and talk about what kind of symptoms there are and what parents and family members, caregivers, educators, everybody at the table with the youth, how they can notice these things, especially, I would say, first steps to where to get help or even what kind of help?
Of course. And I think when we just think about, the development of children, we have to understand they start with us in the home with a very close protective bubble, so to speak, of who they're learning from. And then they get introduced to more factors as they go to school, as they begin socializing, making friends. So they are adapting and taking in a lot. And anytime they're introduced to a new environment, they are not only taking what they've learned, but also learning about what they're seeing and trying to conceptualize and really understand it and kind of grow their understanding. And that can take a toll on somebody's mental health as an adult, let alone a child, because everything is so new. Everything is changing. And that is hard to take in because from a learning perspective, we learn black and white, animal, dog or cat. It's a very compartmentalized where suddenly we're being asked to look at things from a bigger picture. And that's a lot to take in. So when we're talking to families, when we're looking at children, and we'll start even with the younger children, the things that we're going to look for in terms of concerns about, mental health symptoms is when they are not acting as themselves. And not to say that children aren't going to learn and grow and change, but I think those stark differences suddenly being a contrast to what you've seen, those are things that are kind of should be like alarm bells. I don't think that you jump in immediately and you're like, oh, they like this on Wednesday and suddenly on Thursday they don't like this. But I think it's when they are not being consistent in the things that they've been doing and they seem really turned off by the things that they once cared about or kind of how they went about things. Because when you think about children, they love a good routine. They love a good structure. That is something that really helps them and they thrive. So when they are suddenly, and again, developmentally, toddlers are going to push back, little children are going to push back. If they are seeming avoidant of certain places, if they're seeming avoidant of certain people, if they are not playing with their toys even in the same way that they used to. And that's, again, very small children. Now, if you kind of graduated up and we're looking at adolescents and teens, it is a very similar thing, but they're not talking to their friends. They might not be talking to the family. And again, we got to take in teen temperament, they're changing and going through a lot, but it's that performance in school, things that they once cared about, they're suddenly feeling apathetic. They're suddenly like, you know what, no point in trying. They are just less invested in the things that make them happy. And I think that those are some kind of initial signs to look out for. And I think if you ask them, which is going to be the first place I would say start, go ahead and ask them what's going on. If they don't have a good answer or an answer that kind of is a little more thought out, I would keep inquiring to some degree, because even though they're not going to know exactly what's going on with them, they might be able to verbalize some things like, you know what, I've been feeling a little more sad than usual, so I've been more tired than usual. And that's an indicator of some mental health conditions such as depression, or I'm feeling a little uneasy. That's could be anxiety. So there's a way, even if you're talking to them, even if they cannot verbalize the symptoms, when you're talking to them and asking them questions, you will get some insight on maybe what they're feeling and what they're thinking.
Wow, I love that. Everything, so much to think about, so important, but I love how you broke that down. Thank you so much. Very key. Being a mom myself, I can just look back and see, and that's so important for parents just to kind of keep an eye, the awareness factor. The idea, I love what you said about like children loving structure and a routine. And if there's just a break from that, and their happiness mode kind of is not there where it used to be, and things like that. And just really just go ahead and asking them, too. We tell even adults, reach out, ask for help. But we, as people who care about, our loved ones and things, we can do the same. We can ask them, correct? Is that what I'm hearing?
100%. We can ask them. And I mean, I've seen clients where parents are like, my child has always been the shy one, or just always been the quiet one. And they attributed so much of that being their temperament that they didn't realize that their child had depression. You can be quiet. You can be more introverted. And also you can have depression, and they might mirror the same way. But I think how we get to delineate and differentiate these things is by having conversations, by being able to track, oh, you know what? This is really their temperament. They're quiet versus they're quiet and they're telling you about these stressors, or they're not sleeping, or they're having issues with their friend groups. And then you can say, okay, well, I can see how you would be quiet and feel upset or unmotivated or just overall uneasy or uncomfortable. And I think that that's information that we take in. So being afraid is taking away the opportunity to not only get a baseline of your child, your teen, but also be able to understand their perspective and what they're going through and how they are processing and dealing with it, even though half the time they don't know how they're processing and dealing with it.
I was thinking as you were talking, brings me to like my next question is, being a health professional, mental health professional like yourself, what kinds of testing, or how do you assess the symptoms to get like a specific diagnosis or even a first step in a treatment plan?
Of course. So one of the things that I say, especially when we're talking about children and teens, is really utilizing your primary care physician, because oftentimes they're going to be the one to get the ball rolling. Of course, people go into the doctor and they're like, oh, I have to have a bruised arm, or, all these outwardly physical things. But when we think about our mental health, that has something to do with it. And that is health. So the doctor, sometimes if they're saying, okay, well, I'm noticing that I'm having a lot of stomach aches. And the doctor might kind of inquire like, oh, okay, is it something you're eating? But also it could be situational. If you're a parent and you recognize for some reason their stomach is only hurting, or most of the time hurting when they're at school or when they're away from me, or, these somatic symptoms that are physically generated by what we're experiencing with our anxiety, depression, other mental health concerns, they do show up in the body very physically. So if you have that recognition of, okay, their behaviors have changed, they're a little more withdrawn, or they just seem a little more on edge, they might be crying more, emotionally displaying some things a little more openly or less openly, they might really go inside, letting the doctor know. because they will be able to help recognize that, maybe we can start doing some assessments, some screeners for basic anxiety, depression. That is really where we get the ball rolling. And they oftentimes will screen for various things, not just those anxiety and depression. Those are just my quick, easy ones to talk about. But I think that gets the ball rolling on, okay, if this is something that we can have a referral to, a therapist or a psychiatrist, and both of them oftentimes at the same time, this is something that we can pass on because we want to make sure that this part of their health is addressed. And that is kind of the pipeline to getting that emotional mental health piece addressed. And I think recognizing that because it's not this outwardly physical thing, that you should still bring it to the doctor, because the doctor will now serve as a conduit to where we go to treat this, just like they would do with any type of specialty. If it's something outside the primary care, they send it to the person or the specialty that would be able to specialize in it and really formalize what's going on. Now, the second part of the question is, how do we get into a treatment plan based on that? So say a doctor has recognized that a patient has some mental health concerns and potential diagnoses that they want to have looked at. They might recommend going to a psychologist, a therapist, a psychiatrist. And at that point, the psychiatrist, psychologist, the therapist, the mental health clinician will sit down and really go through the biopsychosocial history of the client to really try to understand what are the symptoms, what is the environment outside of them, what is going on inside of them in terms of emotion and, just perception. And that helps us understand and really formalize a diagnosis. From that point on, figure out what your diagnosis is, then we can say, okay, there are very specific treatment modalities that really align well with treating this type of diagnosis versus another type of diagnosis. And that is kind of what you're going for. You have now understood the landscape of the diagnosis, the specifics in the landscape of that person or that child or that teen in terms of what their symptomology looks like and what they're experiencing. And then we target those things. And I think that it's almost an inward out approach and an outward in approach at the same time. It's preparing you for the things that come in as a stressor to your symptomology, but also the things that you may not have identified in terms of your symptomology and bringing that awareness. So that way you are just kind of seeing right here in the short term, in the short frame and the long frame of what's going on with you, so you can cope. So you can prepare, so you can even know when to ask for help when something feels outside of what you know or what you feel you can handle.
Wow, that's a process. And as we know, like what you said, you were really key on that specific type of diagnosis, that it's so individual, and that no one treatment plan is the same as another treatment plan. Yet there's a process to get to that point, but that each modality or each recovery point, each treatment plan is different for the individual based on all of these steps that you had mentioned, correct?
Absolutely.
Okay.
And that is a sign of a good treatment plan, in my opinion. If you are going from the understanding of what the diagnosis looks like, but using the specifics of that person's personality, temperament, coping style, communication style, you are really doing them a service by setting them up for success in treatment.
I love that. I love that you mentioned their coping style, their communication style, how they interpret information is so different. Somebody's lived experience or experience of a situation feels and sounds and different than the next person. So the coping and the communication style is really important to talk about. That's another thing we need to talk about that even deeper. Because that's a thing, right? I mean, in anything, but let alone how we receive information, how we interpret information, and how different that is, or the circumstances may be completely the same for a situation, but so different for the individual. That's another something to to dive into at some other point. But yes, and we know, thank you for all of that. That was so great. I'm learning as we talk too. There's so many statistics, and without going through several of them, but specifically for our conversation, 1 in 6 US youth ages 6 to 17 experience a mental health disorder a year. So clearly, that there are many that are impacted, and no one is alone in this struggle. And that is so important. And it sounds, people say that all the time, but it's so true. No one is alone in this struggle. So I guess I want to ask, how did the family members, the educators, or even friends help this age group talk about what is bothering them? Like actually even get them to talk. I know you had talked about some things earlier, but how do they help them talk about it? If you could give 3 tips, okay, let's narrow it down here. So if you could give 3 tips, what would that be?
Yes, and I'm glad you said give me 3, because you're right. I would give you a litany of tips and advice and things that you can do. So I am going to, yes, I'm going to really try to summarize this. And I think the 3 tips that I'm going to bring are 3 tips that everybody is capable of doing.
Okay.
You don't have to have an expertise, a history, extreme knowledge about this in order to do it. And the 3 tips that I've narrowed down is I would like for you to listen openly and compassionately. I would like for you to validate, and I would like for you to speak up. And I'm going to explain exactly what I mean in each one of these. Okay. So when I say listen openly and compassionately, I like to recommend that loved ones, teachers, friends are just that sounding board to just let that person speak. You're not necessarily there to solve their problems, but you are demonstrating a very important facet of, if I am sharing something, somebody cares enough to sit here and listen to me. And I think when somebody is seeing that pattern in people that they love, when they get into the doctor with this unfamiliar person, or, the therapist with this person they've never seen before, and they're expected to talk, they already have this recognition of, my friends and family listen to me, and there is a need and a value for this. So I'm going to go ahead and try it and take the risk, because I haven't been continuously shut down or ignored, or, just genuinely not listened to. So I think, for loved ones, my first, tip would be just listen, compassionately and openly. And sometimes listening isn't responding in a way of like, oh yeah, I hear you, perfect. Like sometimes it's like, wow, thank you. And just, I appreciate you sharing. And that kind of rolls into a nice segue for the second tip, which is validating. You are not always going to have the right answers, no matter who you are. I'm a mental health clinician, and I know I don't have the right answers all the time. But one thing I can do with certainty is validate a person. So as a parent, as a teacher, as a friend, I know that I can listen to somebody sharing what they are experiencing and feeling and say, wow, thank you for sharing. I appreciate that you feel comfortable enough coming to me to share this information. I value the fact that we have that relationship. Also, validating them is letting them know, I don't know how you feel exactly. I heard what you said, and I believe what you're feeling. I don't have a judgment on if it's real, valid, worthwhile. That is not my place. I'm validating how you just expressed how you feel. And I understand that it is important for you to recognize that you are being heard. You are not being challenged by what you just shared me. You are just able to express it. And I fully believe and hear that that is how you're feeling. And then the third one is speak up. I think, and I really want to emphasize this for everybody across the board, because I think there are times where, especially when we're talking about friends, peers of the same age, I know that it's a hard task to say, hey, like, my friend shared something that kind of scares me, or, I feel uncertain about. But I think that that is something that we really need to normalize is, hey, if I'm talking to you and you're sharing something as a friend or as a peer, because I understand it's different when we're talking about teens and children versus adults, but as a friend and as a peer, hey, I really think like you should talk to your mom. Like, could we go together? I know like what you said is like, I think super helpful for maybe our teacher to hear. Can I go with you? Can I support you? I think that that is a good route. But then again, also, I think from the teacher perspective, from the parent perspective, I think recognizing that you are not always in a position to solve the problem, but you are in a position to figure out who to go to help get the problem solved. And I think the reason why I'm saying speak up when we're talking about the adults in the life of these teens and adolescents and children is because I recognize that sometimes there is a sense of shame, a sense of guilt that I don't know how to solve my child's problem. And if I am taking them somewhere, it means I have done something as a parent, or I haven't done something as a parent to educate myself. As a teacher or somebody close in that child's life, you might be saying, there's that sense of shame potentially of like, I should be kind of the authority in this situation. I'm a teacher. I'm this type of professional in a child's life. And just because that is your profession doesn't mean that you're always going to be the person to solve that. But again, you are that line to get them to the right person. And you have that ability to know who to reach out to allow for them to speak up and have what their experience listened to, told to the right people to make sure that they are going to be cared for and treated. And I really want to just say this to the parents. And this is, I strongly believe this. You are not a bad parent because you can't fix this in-house, or you don't feel you should be able to or can fix this in-house. That does not make you a bad parent. You are an exemplary parent if you hear them and you say, okay, this is out of my scope, and that's okay. I love my child. I support my child. I do everything under the sun to take care of my child. And that includes linking them with the right services, with the right professionals to continue my goal and my care and love for my child. And I really strongly believe that. And I just always want to really reinforce that to the adults that are in these children's lives, because sometimes they don't know how to solve it. And that does not mean that there is a deficit in what they are doing as a parent, as a supporter, as a loved one.
Wow, that is amazing. So the 3 tips, the titles, just throw those out, just like you had the listening, right?
Yes. Listening.
Validating, and
Yep.
then speaking out. And then you did a
Yes.
beautiful job explaining that. I love the speaking out part. I think that, honestly, like you said, there is a shame to even someone who would want to reach out or ask or help because they don't know, like you said, but you just gave 3 great tips that everybody can do. And I love that. Thank you so much. And you were talking about linking. This is something I think that, we all hear it, I've heard it, but what are the linking causes of a mental health condition? As we know, it's not just the result of one event, or is it? Because people go, was it just that one thing? What triggered it? Or is it one event? Is it not? Are there common threads that perhaps many youth can relate to if we normalize the conversation more? And if so, how can that be helpful to other youth and teens? That's a loaded 4-parter there. Do you see where I'm going or with that?
Yeah. No, I'm totally following you. And I think when we're looking at stressors, factors that contribute to mental health diagnoses, I think we have to look at it as, multidimensional and multifaceted as we are as people. Yes, our home environment, the environment we grew up in, that is a formative area of teaching. So that is something that we have to kind of look out for and understand that there's a link to that. Then the social environment, the environment in school, the environment with peers and friend groups and people that you are deeming close to you. That is something that plays into it, because again, now we're learning about different communication styles, different temperaments and personalities that might be vastly different or vastly, almost so eerily the same sometimes. And you never had somebody in front of you that almost is a mirror image that has come from a completely different background in terms of, coping styles and communication styles. But either way, you're getting those experiences. And again, just taking in that information oftentimes can be a stressor because you are trying to understand the world around you. Also, I think, academics, I think, especially as teens and as children, we're learning the things that we feel that we're good at. We're also learning things that, oh my goodness, we don't feel like we're adequate at. And it's not to say that that is a problem. We all find our strengths. But I think being able to understand that finding things that you're better at than others in terms of yourself, not comparing to others, is part of the learning process. And sometimes it can be a stressor because if, say, you have a sibling or a friend that is excellent at running track and you're not, but you're excellent at math, like understanding that those still matter. You don't have to be the best at the same thing other people in your environment are amazing at to be valid and valuable and be good. And I also think that other factors just contribute to mental health stressors is just how we're living. Are you able to have, quiet time? Are you sleeping well? Do you have family time? Do you have enough time to enrich your mind? Read books. I mean, even as children, are they reading books? Are they learning something? Are they exploring? Are they able to go outside and see the world? Like, not having those multiple facets of life and not being able to explore all of them can contribute to mental health diagnoses because you are not getting everything you need out of life, or you're not able to experience everything you need out of life. And that can be a factor because if we're not acknowledging our full authentic self, we will fill that deficit. And I think that that is important. And that is the most common thread. When we are not being our most authentic version of ourselves in all facets, we feel that emotionally. And I think that that is the most common thread. And I think, honestly, when I think of teens, I feel like they are almost the target population that I'm speaking to about that authenticity, because they are at a time period where they are figuring out themselves through the lens of others, which I don't love. But
I don't love
when
it
we
either.
think, yeah,
Yeah.
but when we think of social media, when we think of how we are trying to define ourselves, oftentimes we are building our self-esteem, we're building our value system based on how others are going to perceive it. And that is not you being your authentic self, because you are morphing yourself from the outside versus inside going out. And I think that that is kind of what I really want to speak to in terms of stressors. If you are not living authentically, if you are not discovering your true passions, your true values, your true just kind of self, you are not going to feel great, unfortunately. You are going to be experiencing things that are uncomfortable in life. We always will. But I think that that is kind of part of it. If, you're not being able to attend to yourself. And I think when I say authenticity, you got to know yourself to know what's authentic. So I think constantly being in conversation with yourself about what you're experiencing, again, allows for us to delineate, am I having a bad day? Or this is an experience that I'm living with that is hurting me, that is causing me dysfunction with my friends, family, academics, things that I enjoy doing, because that is a telltale sign. I think at the end of every diagnosis, when we're going through the symptoms, says this this impairment is causing some type of change that is negative to your social, occupational functioning, or academic functioning. So being able to see the results of what you're experiencing causing a deficit in your life in some way, that is what really solidifies this is a diagnosis. This is changing your way you experience the world. And that is not fair to you. And nobody should necessarily have to feel that, especially all the time, and especially without somebody being aware of, hey, let's get you some resources to lessen that pain, to lessen those symptoms, to relieve some of those symptoms, to get rid of some of those symptoms. That is kind of the goal here. And that is kind of what I kind of like to say is a common thread, or I guess a factor. It all pours in, and the pouring out is not the outcome that you deserve because of you having an authentic life and you being able to live the life that you want without that mental burden. I think that is kind of, I'm sorry, I'm being so
No, I love it.
so
And I mean,
verbose,
yes,
but
and not no. I mean, no, I would like love you to keep going on. And I hear that, like, it's so important that the world is so much bigger, and to find your authentic self, there's so many, like you said, it's multifaceted. There to nurture, that's what I keep hearing, the word nurture is such a big part of that. Like, who are you? What are your likes? Do you like to go hiking? Do you like to read a book? Do you like to, all these different things that may, all independent of who we are so important, because if we don't find those things, what you're saying, we're going to find other things to fill that deficit is interesting. And once that keeps filling up that deficit, that's when it starts getting in trouble. Things start breaking down as opposed to building up. Am I
100%? It's like you're saying, filling that deficit. When you start to fill that deficit with maladaptive coping skills, such as, just, I mean, we can start with eating disorders,
right?
restricting of food, over exercising, maladaptive coping skills such as hanging out with peer groups that pull away from your growth, from your academics, that put you in situations that you don't feel comfortable in. Sometimes the maladaptive thing could be simply using, substances. There are a variety of maladaptive coping skills that can occur when you are trying to figure out what that need that's not being nurtured is, and you don't have the answer, or don't feel like you have somebody to go to help you maybe kind of brainstorm to figure out some of the ways you can cope in a way that, again, doesn't pull you down and away from your, authenticity of your overall goals, but like you said, nurturing and pulling you up, being fulfilled.
Yes, and that can happen. That most certainly can happen. We can do that with one another by having these conversations and getting, coming, like those 3 tips. I just love it. Listening, validating, speaking out, and how you explain them are just so wonderful. And those are things that we all can do for one another, for our youth, for each other. And knowing and being confident that, I love what you said, that it's okay if you don't have all the answers, but those 3 things we can all do, and they move the conversation along, and it can certainly help someone who is having the struggles, our teens, our youth, our friends, our loved ones. If there's one thing, I guess I'm going to ask, I mean, I don't have another question right now, but if there's something that you would like to kind of leave folks with or anything like that, I'm going to throw it
Yes,
up to you.
thank you. Thank you. The one thing that I want to leave everybody with is the resource of the Suicide and Crisis Lifeline. It is the 988 number nationally, where you can call, text, chat. I want everybody to go ahead and know that number, to share that number, because there is a resource on top of resources that you can start with. And parents, like I said, when you don't know where to go there. Let's start there. They can provide resources. They have an understanding of crisis, and even especially when we're talking about suicide crisis, that I think needs to make sure that everybody is aware of and that is out there. So that is really what I want to leave you guys with, is knowing that, on top of practicing those 3 things: listening, validating, and speaking up, because that is how we really get to the bottom of this epidemic. And that is how we let our teens, our adolescents, our children, the people around us as adults know that they are not alone and we care.
Well, I'm going to leave it there because I couldn't have said any of that as good as what you just said. Thank you so much. That is beautiful. And we'll have that number in our post. Thank you so much, Breanna, for the time and just your expertise and your compassion and your passion and just your overall awesomeness to share these things with us today. And this video will be available ongoing on Breaking the Chains Facebook, YouTube, and Instagram. So people will be able to watch it at their own time. And we will tag you, Breanna, and as well. And just thank you so much. I really, really appreciate it. And yes, just thank you. And have a beautiful, beautiful day yourself. I know we'll be
Thank
talking
you.
soon again.
Yes, thank you. And thank you for having me.